Hi, my name is Roseanne Tornator, and I came to Dr. Gulani because I was referred by a friend. Since I've been here, I've referred probably a dozen people because I feel it's very important. Your eyes are the windows of the soul, and I was not interested in trusting anyone. I came with a friend and I was very impressed. After Dr. Gulani tested me, we realized I had 4 different problems. Astigmatism, I couldn't see very well distance-wise, but I couldn't read very well at all, and I own a store, and it's very important that I can see the pricing and the tags. And since then, I've been amazed. I don't need glasses for either distance or close reading. And I really feel that glasses hanging around your neck make you look old. And I'm really interested in being fashionable and looking young. And I think it's very important to have the confidence of a doctor who's not only very personable, but has world renown. I remember when I went into my surgery for my cataracts, there were doctors on the outside of the room waiting to see the operation, and I was very nervous. And it was the first time I had ever done anything like this, and so Dr. Gulani came in the room to get me, and he said, "Are you ready, Roseanne?" And I said, "Well, I'm a little nervous, I feel like crying. And there are doctors out there waiting, and we need to get in there." And he said, "No. It's important that you are fine and you are ready, and when you're ready, we'll go in. What I care about is how you feel." And to me, that said volumes. One very good friend of mine I brought up here, and keep in mind I travel 100 miles to come to see Dr. Gulani and passed many doctors on the way. One of my friends had trouble with his eye for a long, long time, and a doctor had operated on him, which of course I won't tell you the name, but that doctor said that there was no hope for this man. Dr. Gulani saw this man, and inside of a week, this man was seeing for the first time in his life. Apparently that first doctor did not clean around the retina or something like that, and the eye was impaired because of that. So the confidence is there for me with Dr. Gulani. And I've seen people come into his office from all over the world. One such situation, the newspaper was here, and there was a man that had blown up in a tankard in Iraq, and 10 doctors in the United States said he'd never see again. And I want to cry because he was kneeling down, tying his daughter's shoelace for the first time. To me, that gives me the confidence, or gave me the confidence to work with the doctor. When I came to Dr. Gulani, he showed me options for my eyes for my cataract surgery, and I decided to use the new generation lens. You certainly have choices when you come, and every patient is different. What I needed may not be what the next person needs. I know that I've sent a dozen people here, and they've all had different procedures because everybody's an individual. The biggest thing I like about Dr. Gulani is that he's very personable. Most doctors, as you know, don't have a bedside manner, as they say. And Dr. Gulani spends the time that it takes to make a patient comfortable, and he does whatever it takes to make the patient see again. And again, every one is different, but I feel all of the people I have sent are very, very happy. Well, I can read very close. I can read very long distance. I've never been able to do that before. I always needed glasses hanging from my neck. And I mean, it's just amazing. I can read all this far away, and I can read this way. I can read tags up on the ceiling, which are very important to me, to my store. So I'm just really very pleased with the results that I've received.
So, Roseanne, regarding cataract surgery, we are seeing a trend that younger and younger patients are now presenting with cataracts because of the current trends and technologies and predictability of vision outcomes. The way I approach cataract surgery is, cataract, as you know, is your own natural lens that was crystal clear before has become cloudy, correct?
Yes.
But because it was a lens, it had a power to it. So since we're already there doing your cataract surgery, my principle is, why not put in a lens that can correct most of your refractive errors and we come out. So in other words, cataract surgery always needs an artificial lens to replace it, right?
Right.
That artificial lens selection is where this becomes a unique art, where you decide, okay, I want a certain kind of lens because I not only want to correct the cataract, which is clarity, I also want to, if possible, cancel off her farsightedness or nearsightedness. And if the lens is progressive, like the new generation multifocal lens that you had, like the Restore, that makes you see distance and near both.
Right.
So when I look at a cataract patient, I decide, okay, they have cataract, meaning their vision is cloudy, but they also have near or farsightedness, they also have astigmatism, and they are also over 45, so they have presbyopia, can't read. So how many problems do they have? 4.
Right.
While you're doing cataract itself, you can address 3 of these 4. By removing the cataract, which is the cloudy lens, and putting a clear artificial lens, you've already corrected one problem, clarity. Now the lens could be powered in such a way, designed in such a way that it also cancels your far or nearsightedness. So we cancelled 2 problems here. That lens could also be new generation multifocal lens, a progressive lens that helps you read also. So now you got 3 issues corrected. The only one remaining now is astigmatism, which to correct, because astigmatism is a function of the shape of your cornea, the viewfinder of your eye. You come with the laser and do advanced LASIK on top. So now you see how cataract surgery itself becomes a designed concept that every patient can, through cataract surgery, come out with vision without glasses and start seeing distance, near and clear, just like you. And even in your case, as you know, I mean, it's a privilege for me. You brought so many of your friends over for surgery. Now think of each one of them. Jerry was so farsighted, we did a different kind of surgery with her lens. Her husband Lenny had cataract surgery elsewhere. We did laser on one eye and we did a toric or astigmatism lens in the other eye. Your friend Mark, who was high astigmatism, we did an advanced LASIK on him. Bill, your friend who had radial keratotomy before, we did a laser procedure on him. All these patients are 20/20, but yet the procedures were all designed differently. So to me, that is the most important aspect of where vision corrected surgery should go to. It's an art.
And this is what impressed me most about you. Most of the doctors that my friends and I have been to just wanted to pop us in there and do some LASIK, and that's it. You think of everything, all of these different things, which is very impressive to me. That's why I brought all these friends to you.
Like I said, Roseanne, to me there is no higher honor. Like I tell my staff, I tell my patients, I'm indebted to my patients. It's this privilege, this is to me payback when I see each one of you, all of you seem perfect, and each one had a different kind of surgery.
That's true.
So it's intriguing when surgeons come here to train with me, they see this, that the planning is what takes time, and the planning for each person. I mean, nothing wrong with people doing cataract, like, hey, okay, cataract, let's go tomorrow and do the surgery. Fine, but see how many more things you can correct while you were there in surgery.
Correct.
And I think that's the future, where customizing the eye surgery to make every person, every patient see the best they have the potential to, and without glasses, is the future of eye surgery.
You're the future.
Thank you so much, Roseanne. Again, I'm honored and enjoy that vision. Okay?
Thank you.
Thank you.